Our foundation was formed in 1958. The mission of Community Howard Regional Health Foundation is to help the hospital provide quality care for our patients, our employees, and our community. Our patients are helped through the Patients Assistance Fund, which we raise money for, and that can help with cab rides. We purchase medications, we can do gas cards, and as far as the hospital, we have purchased over $1 million worth of patient equipment as well as furniture in the last 5 years. Two great ways that we have done that would be our Community Care Mobile. That is basically a $300,000 RV that we can take to events. We use that as a lactation station. We can do screenings, and we have provided many people in the community premium health care through that. As well as we have the Community Care Paramedic Program. We purchased the car so Mark is able to go out and offer premium health care with some of our patients so they do not have to come back as a readmittance to the hospital. Everything that we do would not be possible without our donors. So a huge thanks to everybody who has ever donated to Community Howard Regional Health Foundation.
So recently we had an employee who came across a patient who was in the parking lot, just in his vehicle, and just struck up a conversation wondering what he might be here for, and through the course of that conversation realized that this individual was planning to spend the night in the parking lot because he came from out of town for services and didn't have enough gas to get back and forth 2 times. He needed to come today and he needed to come tomorrow. So we were able to use the foundation funds to purchase some gas cards to provide that transportation. We don't have such strict guidelines that we think, well, this won't qualify or that won't qualify. For people who kind of slip through the cracks of other types of programs that we have available, we're able to meet those needs so that they can get their health care and can just not worry about the groceries or the ride that they couldn't afford or the gas money or whatever during that period of time where they're already stressed enough.
The program exists basically to help reduce readmissions into the hospital, so to help lower our readmission rate. And that's where it started out with me as well, looking for that. But as the program has grown and has gone on, what I have found is it's about a relationship building process with the patient. I think one of the biggest things, one of the biggest values is that people feel like that they have somebody that they can call and talk to and have come visit if they need to visit and reevaluate, just do a medical assessment. It gives them that comfort. The vehicle has been a valuable resource, not just for the community paramedicine, but also for our 911 system here in our county. Without the foundation's support, we would not be able to, I don't think we would be able to purchase the vehicle and have the vehicle that we have. And so the foundation is very instrumental in getting this vehicle purchased and getting it up and running on the road.
Yes, it helps me a whole lot. I'm 93 years old, and him coming to my house is just like having a doctor make a house call. And it's been a blessing to me, it really has. He's kept me from going in the hospital about 3 or 4 times. It really relieves me because it makes me feel safer, because I know that I've got somebody that I can depend on.
As a therapist, we're able to get the patients up into the chairs so they'll sit up a little longer. The chairs are a little more comfortable, or a lot more comfortable than the last chairs that we had. If they have immobility issues, there's a feature on the new chairs that we have that we can put the armrest down, and it's an easier transfer for us and the patient too. If we have patients that need elevation of their legs, these chairs recline, which the other chairs that we had before did not. It means a lot to us to be able to have really nice chairs for our patients, comfortable chairs for our patients, chairs that have a foot pull out where they can push down and scoot themselves back versus us scooting them back in the chair. It means a tremendous amount to be able to come into the room, and the patients are more motivated to get up in the chairs than they were previously with our other furniture.
On behalf of the whole Howard region, I would like to express our appreciation to the Foundation. The support you provide to the hospital, to our staff, and most importantly to our patients is truly appreciated, and I want to give you a heartfelt thank you.